It's another breaking development this afternoon, the confirmation of the first death linked to the measles outbreak in West Texas.
State health officials say the school-aged child was unvaccinated and had been hospitalized in Lubbock. Now, this is the first reported death from the outbreak that began last month and the first death from measles in the U.S. since 2015. In the last hour, Covenant Health in Lubbock held a news conference about the death, and this is what they had to say.
This measles is a very severe illness that has a mortality rate of about 3%. And so knowing that when we have large outbreaks, unfortunately, statistically, there's a significant risk of having a death.
Now, many of you may have questions about measles, and with more than 120 cases in Texas and New Mexico and this recent death especially.
Yeah, so we went to Google for the top questions that people searched for. Our Dawn White then took those questions to a doctor. She's joining us live now in the CBS News Texas newsroom with what all he had to say. Dawn?
Well, Ken and Karen, this afternoon I met with Dr. Kahn. He's the Chief of Infectious Disease at Children's Health in Dallas. He believes the reason for the cases is a low vaccination rate. Dr. Kahn says about 95% of the population needs to be vaccinated against measles in order to avoid an outbreak, and vaccination rates in those affected areas are only between 20 to 50%. I asked the doctor the top 3 questions about measles on Google. The number one Googled question is, are measles deadly?
I think the fact that we have one death already in just 124 cases really points to the fact that these types of serious illnesses and even deaths occur in measles outbreaks. And we got to make this as a priority, not to take this lightly, even though most of the children who get measles will eventually recover. But
now let's get to the second top question asked on Google. How are measles spread?
Measles spreads by contact with somebody who has measles, and the measles is spread through respiratory secretions or droplets. It is the most contagious infection or virus that we know of. If you put 100 people in a room who are not immune to measles and one person enters that room, at least 90% of those people are going to get infected with measles.
And finally, I asked the doctor, what are the symptoms of measles besides a rash? He says it can easily be confused with other common respiratory virus symptoms.
When a person has measles, they have a cough, they have a running nose, upper respiratory tract symptoms, maybe some red eyes and fevers.
And you may be wondering how widespread measles could become in North Texas now that we have that confirmed case in Rockwall County. I'll have the doctor's answer to that coming up at 5. Live in the newsroom, Dawn White, CBS News Texas.
All right, Dawn, thank you very much. We look forward to that report at 5. Appreciate it. Well, folks, if you discover that you have measles, doctors say that you should rest, drink lots of fluids to stay hydrated, and take fever-reducing medication to manage some of the symptoms. Now, you should also wear a mask and stay at home to avoid spreading measles to others. That's very important. You're also being advised to call your medical office before going in to see your doctor.